Hi, my name is Kelly Watkinson and I'll be discussing the role of the nurse in medication management during the preoperative phase. Before the nurse administers any medication to the patient, it is important that they perform a patient assessment. By doing this, the nurse will be able to use their knowledge of the drug's pharmaceutical effect on the body against the patient's current vital signs and condition to prevent any potential unwanted side effects in theatre and to ensure changes can be easily recognised. As a nurse, it is important to be aware of what medications a patient can and cannot have before surgery. Certain medications can have dangerous side effects for the patient if taken whilst under anaesthetic or before surgery, whilst others are safe to continue. Some medications may require discontinuation or temporary dose alterations to avoid perioperative complications. One of these medications is insulin. If a patient is a diabetic, therapy will generally involve adjusting the routine of the dose and careful monitoring of blood glucose levels every 1 to 2 hours. The previous night's insulin dose may be decreased to account for fasting, or the physician may request the patient's insulin to be withheld until early in the post-op phase. Patients with diabetes are often scheduled for surgery early in the morning so that fasting for surgery affects their condition as minimally as possible. Along with diabetic treatment, ACE inhibitors, used for treatment of congestive heart failure and hypertension, are often requested to be withheld for the dose immediately before surgery to prevent bradycardia and refractory hypertension during anaesthesia. Another drug class to also consider is anticoagulants. Drugs that affect coagulation include heparin, warfarin, aspirin, and NSAIDs. Procedures with a low risk of bleeding may be performed in patients taking anticoagulants, whilst those with a higher risk of bleeding, such as neurosurgery or cardiac, require discontinuation of warfarin therapy. Whilst there are many medications that must be withheld for surgery, there are also many which don't have systemic effects, so are safe to continue. Beta blockers, commonly used for treatment of angina and arrhythmia, are recommended by the American College of Cardiology guidelines to continue preoperatively to avoid disease exacerbation related to withdrawal. The statin class should also be continued through the perioperative period unless a patient has an acute coronary syndrome, in which case they would need to be assessed by a clinician to compare the risks of withdrawal compared to continuation. Antiarrhythmics such as amiodarone and digoxin both have long half-lives, so are continued due to discontinuation being impractical. Psychotropic medications such as SSRIs and MAOIs are also believed to be safe to continue. Anti-seizure and Parkinson's medications should also be continued throughout the perioperative period, as symptoms can recur within hours of a missed dose. Along with these drugs, an increase in coronary events and stroke has been recorded when patients on long-term aspirin or NSAIDs discontinue treatment, even for short periods. Discontinuation of these drugs before surgery is rarely indicated, considering specific reports of bleeding problems associated with these agents are rare. These continued medications can be taken as prescribed with a few sips of water. Throughout these medication administrations, the nurse needs to ensure that they follow the 5 rights of medications, being right drug, dose, time, route, and patient, along with ensuring that they have completed all appropriate documentation. Thank you for watching.